So it's time for breakfast. Larry eats a hearty bowl of oats with blueberries and walnuts, and it's about 7 a.m. So we're here, it's about 7:20, we're about to start checking results. Larry's keen to get on there and see if we have to call any patients in urgently today, if there's any skin cancer excisions that we need to rebook, or if there's any reports from a specialist that we'll need to update the file, medications and other things. First consult of the morning was a men's health consult. We looked at someone's cholesterol, their PSA, as well as talking about their hernia and adductor injury, all in 15 minutes, and excellent outcome. So next patient, we've got something stuck in someone's ear, stuck piercing presumably, so we're going to try and get it out with some local anaesthetic and some mosquito hemostats. Hopefully we won't have to send them to ear, nose and throat, and we can solve it here in general practice. Successful removal of the earring, kids off to school. So we've got a patient with high potassium on routine blood tests. Often this is a furphy from some red blood cells hemolyzing, but it's important to follow up because if they do have genuinely high potassium, it's concerning for their heart. So we're going to organise a repeat blood test for this patient. Larry's learning about point of care ultrasound to deliver better quality of care for his patients. Apple, very good, quick snack, fibre, keeps you going. So last patient was a flu-like syndrome, probably influenza. While I was auscultating the chest, Larry noticed an irregular looking skin cancer, or likely skin cancer on the back, and he had a look at the dermoscope and the patient will come back for a biopsy when well. I'll try to get out for a lunch walk just to refresh myself for the afternoon session. You can't always get it done, but if you can find the time, it's beneficial. An infective patient, usually a relatively straightforward consult. However, when someone's also a renal transplant patient, it takes a bit of extra time. So, infective patient with renal transplant background takes a bit longer, but we still sort them out. So a lot of people come and see us to get earwax syringed out of their ears. We have a variety of tools for assessing them and then syringing the ears. Larry will have a look with the otoscope. We may do a baseline hearing test with a tuning fork, and usually we'll get them to have some ear drops to soften the wax up before syringing. So Larry and I just had to have a chat with the kid about constipation, which is never fun, and you often have to have little things that help make it easier to talk about, things like poo. What looked like a quiet afternoon ended up being an ambulance call for a patient, probably quite unwell with influenza. So quick cannula, fluids, Panadol, and they were off in the ambulance. We've excised a small cyst from someone's scalp, and we've consulted someone over the phone about belly pain. Important after an ambulance call to take a breather, have a biggie, have a cup of tea, just to get yourself back in the game, settle your heart rate. So that was a full day in general practice, preventative health, men's health, sick people, emergency medicine, some procedural stuff, and now Larry's off to the gym to do his cardio. He enjoys body combat.